What would you say if someone said 2 + 2 = 5?
Well, chances are that you'd say that they're wrong, since our education taught us otherwise.
For most topics, North Dakota prides itself on having the most accurate, up-to-date information available for students in classrooms.
But there is one issue in the educational system that has endured the test of time: sexual education.
KX News' Paige Gilmar decided to hit the books and the classroom to learn more about how North Dakota's sex ed programs are impacting our youth.
Data on the sexual lives of Americans shows that abstinence is more the exception to the rule than the rule itself. According to the Institute for Family Studies, 90% of Americans have sex before marriage. In fact, Planned Parenthood North Central states found that around half of North Dakotan youth have sex before they graduate high school, mimicking the national average. But in spite of these statistics, sexual education programs in North Dakota are lagging behind modern data trends. Since the Affordable Care Act passed, federal funding has moved away from abstinence-only programs in favor of comprehensive sexual education, which includes teaching on sexuality, consent and assault, using contraception, sexually transmitted diseases and infections, or STDs and STIs, and more. In North Dakota, there is no standardization for sex ed programs, and school districts are left to decide on the quality of sex education in their district. Current legislation also does not require education on sexual orientation or consent. Programs don't even have to provide medically accurate sex education instruction. As a result of the July 1st, 2012 North Dakota Century Code, programs instead must be abstinence-based and emphasize the, quote, social, psychological, and physical health gains, unquote, of abstinence.
We have many states, including North Dakota, that do not require our sex education to be medically accurate. We would not tolerate that for any other topic.
According to the Centers for Disease Control and Prevention's school health profile of North Dakota, a mere 12 to 23% of North Dakota secondary schools taught 22 critical sexual health topics. Less than half of all secondary schools taught methods of contraception and how to use them properly. And because school districts decide on the content of sex ed programs, there are huge disparities in the quality of education, with lower income communities being more susceptible. Most programs instead boast the benefits of sexual abstinence, with up to 72 to 75% of secondary schools basing their educational content on abstinence.
I feel like it was not in depth enough, and I feel like it should have really been, I don't know, just talked about more openly and been a little bit more personal.
3 decades worth of research into sex ed programs shows that abstinence-based programs don't work, leading to higher rates of teen pregnancy, STIs and STDs, feelings of shame after experiencing sexual assault, and poorer mental health for minorities and non-heteronormative groups.
When you see teachers speak from a point of view where they're maybe making assumptions that everyone is going to abstain until marriage, or you make assumptions that everyone is straight, you're neglecting people in your class and you're neglecting to provide relevant content. And oftentimes when that happens, you're actually harming some of the most vulnerable people within your class.
The trickle-down effects of North Dakota's sex ed programs have already affected the population. The Health Resources and Services Administration found North Dakota's teen pregnancy rate is higher than the national average at around 16 females per 1,000. Another study identified that the rates of STDs have seen a 350% increase in the past 20 years, and certain STI rates have risen as well in the state. But there is hope. Christensen, who has been a sex educator with Planned Parenthood for a decade, has found that comprehensive sex ed programs that are implemented early and provide medically accurate and relevant information for students helps lower rates of shame, bullying, and homophobia, and boost communication skills, bystander intervention, and rates of reporting on sexual violence.
So I'm a very firm believer that sex education saves lives and that it can be life-changing. So when we look at youth who come to our classes, for many, many times, that ends up being the first place that they find themselves or that they feel validated.
But it's up to our state to be the change the people need. For KX News, I'm Paige Gilmar.
And you can make a difference yourself.
If you want to address barriers to sex education, you can speak up and contact schools to tell them what's missing in their curriculum, such as information on sexual identity or consent.